This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PH.D. doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning and welcome to the show on a beautiful day in the neighborhood. And as we always like to say, it's a beautiful day to get healthy, right?
Yep.
As it is every day.
It is, John. It is.
Health Watch is the show, Sundays 8 till 9, as the man said. Talk Radio 1210 WPH.D. Dr. Molly FANTASIA, the PH.D. doctor, the executive director and founder of Innovative Medical Associates, is here as per usual. And Dr. Molly's ready to talk to you. And if you have a question, 855-839-1210. 855-839-1210 is the number here in the studio. And as we always tell you, whenever you have a question or a thought, you want to run something by Dr. Molly, that's the time to do it at 855-839-1210. Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly, it's like more and more people are noticing a lot of new patients.
Oh, yeah.
The office is busy.
You know what?
You're working Saturdays?
Yes, we're there every Saturday, at least half a day. Half a day, usually, John. And I think that's good enough to get people in who miss during the week and also people who want to come in. What I'm trying not to do is have my consults on Saturday, but if I have to, I'll do that as well because I want them to get the full flavor of the clinic. And you know, the flavor itself is enough to keep them coming back because it's wild during the week.
And we have patients bringing their dog in. And
well,
the dog,
her dog is a therapy dog, certified therapy
That's
dog.
Right.
Trust me. Nurse Barbara would not let that dog come in if she didn't see the papers.
That's right.
I'm telling you.
So it's like a family atmosphere.
Oh,
but
it is.
Talk about that and talk about, what you do and how it benefits. I've often talked about this, that I don't seem to get colds anymore. And if I feel a little bit funny, I get a drip and it's gone. So
as long as you don't become a drip.
That's right.
That's the key, right, guys? That's what I want. I want to
right.
delineate that. We give you a drip, but we're not making you a drip. So, people who are younger than us won't understand what
That's
that
right.
is.
That's right.
But nonetheless, here's the thing, John. We are a primary care facility. All the caregivers who work with me in one way or another actually have the same philosophy. We can do anything a normal primary care facility can do. You need a prescription, we're going to give it to you. You need radiology, we're going to get it for you. You need laboratory, we do it. We can send it out right from our clinic. So the bottom line is we are definitely entrenched in primary care. We know how to do this. We can advocate for you. My medical director is a great guy. And if we need anything, and I have another doctor there as well, who does some of our injections, etc. So we are, I like to say, 2 docs, no waiting. We're here, right?
And the philosophy is the least amount of pharmaceuticals necessary.
Most important.
And how did you come about that? And what do you substitute?
Well, good questions, because how did we come about it? Because lots of times in the beginning of my career, and also for myself personally, lots of the medication that your docs write for you can have tremendous side effects that affect your quality of life. So, okay, quote unquote, you've cured the condition, but you've made my life miserable. Well, what good is that?
Right.
I want people to enjoy their life. And I think that is a theme that's absolutely throughout the entire clinic, which is why when you say it's like a family atmosphere, it's because anybody who comes in there, yes, they may have a dastardly condition. They may have cancer. This week, I was sitting in there with my patients. As you know, I walk through the clinic, and that's because I'm observing. It's not just because I can't sit still, although I can't. The bottom line is I really walk through the clinic because I'm observing my patients. And I had a whole row of women who actually had breast cancer or some other type of cancer, sitting there chatting, having a great time, exchanging stories and exchanging recipes and things that they're doing for their own condition. Guess what? That is important. In other words, your attitude is such that I'm living life. I'm living with cancer. I'm not dwelling on the fact that I have cancer.
We should mention that, and I know you're very modest and you don't like to talk about yourself, but you had a very serious
I had a serious
medical
problem.
challenge,
Sure.
and that's how you started this.
Exactly. And that my whole vision at the time was I was going to really help folks realize that we can live with these chronic conditions. And we believe cancer is a chronic condition. We believe some of the conditions I'm going to talk about today are chronic conditions, but it's how you handle them. And my belief is God's given us a whole range of ingredients to augment our pharmaceuticals should we need the pharmaceuticals. And they do a good job when they delivered appropriately.
You have had many new consults recently, and the common denominator is people say, well, Dr. Molly, I heard you on the radio, but does this really work?
And I like to say that, of course, we want to look at your laboratory results. We want to look at your physician's notes. We want to look at all of that. But in the end, I want to hear that that our patients are feeling good while getting the treatment and feeling better ultimately at the end of the treatments.
And all they have to do, and the other day I'm sitting there and there must have been 10 people that we were all in conversation, and I'm thinking to myself, if someone new comes in and talks to everybody, they would get the story.
Right. And you can't, listen, you're not going to be able to take the minds of all my patients. Let me tell you, they're highly educated, highly successful people. And by that, I mean they're educated in life as well. They're entrepreneurial and they're just bright people.
And we should mention that all of your hydration therapies are delivered via IV.
Oh, yes.
And you did have a question this week where somebody said, well, how do I know what's in my bag?
Well, we're going to talk about that.
How do I know what's... And a lot of times people say to me, well, your bag is orange and mine's yellow.
And I say, forget the colors, will you? Let's look at outcome. Yeah. That's the thing, John. Forget the colors. Let's look at outcome.
It's like we're choosing paint, Yeah,
no.
Mine's orange, yours is yellow. Well,
yeah.
All I know is how I feel. That's the only thing that's important.
And we have to look at some quantitative data as well. And that's your lab work. That's your radiology. That's some of the, maybe some of the specialists you go to, their notes saying, hey, whatever you're doing, keep doing it.
I should ask you here, because a patient was asking me, and I'm thinking, well, you better talk to Dr. Molly, saying, I've been getting so many treatments. I feel really good. Should I continue? And I said, well, if you're feeling good and you're getting the treatments, I would say, continue.
Of course.
So talk about people who stop and maybe come back later, and, should it be a continual process?
Well, here's the thing. I always tell them, look, I don't want you to have to go steady with me, but the bottom line is you need to keep your reserve up. So there's a way to step you down to do that. Look, John, you go on vacation, don't you?
Yes.
Okay, so you miss a couple of treatments, right?
Yes.
Okay, you're okay. The point is, it depends on the seriousness nature of what you come to me with and the fact that we do have a maintenance protocol, but that maintenance protocol is going to be dependent on what you have. Obviously, if you have cancer, active cancer, meaning right now you're getting chemotherapy, you might be getting some other things, you might be getting ready for surgery, these kinds of things. Well, we want to make sure that we follow that rather closely. So we'd want you to come back maybe weekly or every other week after you're done a course of treatments. And I have some of my cancer patients who say, listen, I'm coming in every week and that's it. Once a week I'm here. And it tends to be working out.
I try to never miss more than a week.
I know you do. I know you do.
And I noticed,
but
after
you have comorbidities.
That's
man.
true too.
Okay, it's not just because I'm on your radio. It's you have comorbidities.
Yeah.
Right. So that's the other thing. I love when people say, "Well, I." Listen, how many comorbidities you have if you have diabetes and you have cancer and you have arthritis? Well, now that's 3 separate conditions. What do I have to do? I have to make sure I rotate some of your things. But I never will lose sight of what's the underlying condition that brought you into me.
All right, we're coming up on our first break of the morning. Our show is called Health Watch, and you'll find us here every Sunday from 8 until 9 here on Talk Radio 1210 WPH.D. I'm your host, John DeMasi, with Dr. Molly Fantasia, the Ph.D. doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. This is a good time for you to call in the show because we always tell you, and it's true, you call in now, you have plenty of time to talk to Dr. Molly. If you call in at the end of the show, then we kind of have to rush you off. 855-839-1210. 855-839-1210 is the number here in the studio. We're coming back. More of today's edition of Health Watch after these words. Back here on Health Watch, operator standing by right now at Innovative Medical Associates. And if you have a question, you want more information, you're a little bashful, you don't want to come on the radio and talk to Dr. Molly, well, you can talk to the operators. Give them a call, 856-489-0505. 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. And the operators will be there well after we leave you at 9 o'clock this morning. Also, check out on the web, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. And our number here in the studio on Health Watch, 855-839-1210. You want to jump in right now with a question for Dr. Molly, 855-839-1210. Before we get back into the show, do want to remind you, Dr. Molly has her new book out, God's Ingredients, TOO.
That's it.
My 30-year journey in IV nutritional medicine, getting some good response from folks.
Oh, yeah.
All over the world, right?
I'm getting a lot. And I want everybody to please look at the Alliance for Natural Health. We really need to start looking at what's happening to our natural products. There's been a big push from the FDA to really hone in on them. And most of the folks who come in to see me, not just the IV products, but I'm talking about the orals. You look, guys, we want our vitamins. Okay, that's my new slogan. We want our vitamins. Absolutely.
And Dr. Molly's book is available on Amazon or anywhere books are sold. God's Ingredients, TOO, My 30-Year Journey in IV Nutritional Medicine. And again, our show is Health Watch, Sundays 8 till 9 here on Talk Radio 1210, WPHT. I guess, Dr. Molly, as a result of a consult, you want to discuss chronic fatigue and fibromyalgia and a lot of little nuances to this whole issue of fibromyalgia and fatigue.
Yeah, here's the thing about fibromyalgia and chronic fatigue is there's a lot of overlapping in some of the symptomatology. However, if in the conventional world, when you look at fibromyalgia, you're being treated as if it's an arthritic condition. All right. When you look at chronic fatigue, you're being treated as if it's an autoimmune disease. So a little nuance there, okay? There is some overlapping, though, even in the conventional world. So when we look at these disorders, we have to look at exactly what are the most severe symptomatology of each. So when you look at fibromyalgia, you're going to look at more inflammation and swelling, all right? But it does have a big component of fatigue. When you look at chronic fatigue, you look at that overwhelming sense of fatigue where a person can't even get out of a bed. We're seeing a lot of chronic fatigue post-COVID. A lot of it. And if you look conventionally, it's getting treated by immunology, which are people who are focused in on viruses. But it's interesting also because post-COVID, I'm seeing people with the joint pains and the swelling. So there's some nuance. We have a caller already?
Yeah, okay. we're going to get to it. Go ahead, finish that thought.
So what we have to do is be very acute in what we're trying to help a patient with through these disorders.
All right, let's go to the phones. We'll pick that up in just a moment. John is in Marlton, New Jersey. John, good morning. You're on Health Watch with Dr. Molly.
Hey, John.
Good morning, Dr. Molly.
My favorite patient. How you doing, John?
I don't know if I'm allowed to talk about what the FDA is doing against critical
I want you to
substances.
talk about it, yes.
Well, I went online, and I've
you.
been studying this thing, and I sent in a form to www.anhusa.org.
Thank you.
Well, there's such a selection. They have, so many in there. You couldn't find anything specific except about compounds.
Yes.
And they were trying to stop the critical compounds and supplements for vitamins, and they're saying that these were used, they were medicines. Before they were vitamins. Well, guess what? They were natural, God's made before they were medicines.
Yeah.
I agree, John.
What are they trying to do? I mean, it's ridiculous.
I think
what they're saying, and even the whole concept of what they're saying is ridiculous.
I agree with you, John, and you, among many of my patients, are feeling like this. When you think about it, what do you think this is going to do? It's going to equalize the playing field for the pharmaceutical companies. They want a piece of this business. That's
Sure,
it.
that's it. They can't get in your pocket and buy the cause and double the cost of supplements, which I mean is ridiculous. I mean, a lot of these companies are saying, well, we made this, and especially NAD. They're trying to take that off.
Oh my gosh, yeah. It's crazy.
Know. It's just it don't make sense at all.
You know, hey, John, it's good that you called, because don't you think with everything we have going on with COVID and everything else, they shouldn't be worrying about our vitamins?
Try to find out what's to stop this COVID.
That's right.
They're against women's health and everything.
Right.
Gagging the doctors so they can't say anything. And
that's right.
I mean, it's just. I don't know. It just
it's
aggravates
terrible.
the hell out of me. But I didn't know what I was allowed to.
I know you're allowed to say it. I'm glad. I'm glad you did. I'm glad you did.
That's all I got today.
Thank you,
All
John.
right, John. John, thank you.
Take care.
Thank you.
You
God
too.
bless
Take
you,
care.
John. That's a really
Thanks a
good.
lot for the
that's
call.
a good call, because most of my patients feel the same way. But the nice thing is, John's helping bring this out to a population that doesn't necessarily know this, that takes their orals or maybe have compounded bioidenticals, these kinds of things. Women's health, really very, very important. But back to chronic fatigue.
You're talking chronic fatigue, fibromyalgia. Muscular pain.
Sure.
It's similar. All of it's similar, right?
Similar, but the specific symptoms vary from the type of thing, the type of condition they have. However, what's interesting, and this is something I don't think many of my patients knew, when we look at fibromyalgia, we need to look at it as an arthritic type condition. Now, there are other arthritic types of conditions. Lupus is also an autoimmune disease, but it's also an arthritic disease. Gout. That's one very interesting gout, because lots of my guys come in, mostly, it's very interesting. Guys, well, how did I get this? Well, it's an arthritic condition, and it affects your small joints. Initially, most times, they get it in the big toe. Have you ever had friends of yours that had gout?
I had it.
That's right, you did. And it's so funny, because it has to do with a particular substance, and you want to eliminate that and go on a diet that actually holds that substance down. Also, you look at arthritis, we know that's bone and joint. That's pretty easy. Rheumatoid. I think of my patient Sandy, and such a vital woman who has crippling rheumatoid arthritis. So there are many types of arthritic conditions that overlap each other. But in terms of the chronic fatigue syndrome, you really need to look at that, because it shares some of the similarities. You may have some pain, but you probably don't have pain in the same areas that people with fibromyalgia. However, when looking at this from the integrative group, you want to look at delivering your old friend vitamin C, who's anti-inflammatory in many ways. You want to look at some specific anti-inflammatories like turmeric for people with the arthritic conditions. You may use a little turmeric for fibromyalgia, but you probably would focus in more on the neuro type of issues for the fibromyalgia patient. So you might use things like vinpocetine. So there are various nuances to putting together a bag. That's why it's so important for a patient when they come in to be somewhat specific as to what has the conventional person told you. Now, I can tell you a situation that happened to me just this week. A nice young woman came in, clearly had all the indications of fibromyalgia. And I said, well, what did your doctor say? And she said, well, she said it's in my head. I said, hey, honey.
You've heard that before, haven't you?
Many times, because people get all blown out of proportion about things like the tingling in the hands and the feet. They think, oh, well, that's nothing. It's something. And I'm treating a very young pharmacist, fairly young. She's in her 30s, smart gal. She's done everything she can conventionally. You can imagine. She knows everything there is to know about drugs, right?
Yeah.
Everything. She said, I think the side effects are worse than my condition. And an interesting issue, it's a fibromyalgia-like syndrome, also has a big component of neuro, and I find out, actually, it's probably related to environmental. So there are so many things that we do, both my medical director and I, when we're looking at these cases as to how we're going to treat in the bag.
All right, we're coming up on our halfway point of the show. It's Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Have a question for Dr. Molly? You have a medical challenge you want to run by her? 855-839-1210 is the number here. 855-839-1210. Again, Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT with Dr. Molly Fantasia, the PhD doctor, executive director, and founder of Innovative Medical Associates. I'm John DeMasi. We return more Health Watch after these words. And we're back here on Health Watch. Operator standing by at Innovative Medical Associates right now at 856-489-0505. 856-489-0505. It's Innovative Medical Associates, Marlton, New Jersey. And as always, you can check out the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And our show is Health Watch, Sundays 8 till 9 here on Talk Radio 1210, WPHT. Again, the number here right now is 855-839-1210. You want to talk to Dr. Molly right now. Perhaps you have a medical challenge or you have a condition. You want to get some information from Dr. Molly on that. It's 855-839-1210. And we were talking, Dr. Molly, kind of wrapping this up about fibromyalgia, chronic fatigue. I wanted to ask you, what's the difference between what you do treating these kinds of conditions? Because I know a lot of times you've had success where others haven't. What's
certainly
the difference
in the quality of life issues.
Exactly. But what do you do that the others weren't doing?
I think the thing is we have to look at the links between them, and then we have to look at again the differences, knowing that fibromyalgia is thought as a muscular disorder where chronic fatigue has been linked to viral infections despite their similarity. And I would say that some of our protocol, including the use of vitamin C, is concurrent for both of those. Again, the nuances are in the additional substances we use in the bag. And I would say that ultimately, though, what we want to do is we want to make sure that both patients end up having better quality vis-a-vis less fatigue, less pain. This is a universal, less fatigue, less pain, and certainly work on some of the neuro side effects that occur in both of these conditions so that people can really go out and enjoy life. So the differences are in the bag, John.
With your protocols, and I've asked you this before on a lot of different situations, people with fibromyalgia, muscular pain, fatigue, et cetera, what can they expect? 10 treatments, 20 treatments, 30 treatments, or is it a forever kind of thing?
Well, I would tell you that both of these conditions tend to be chronic forever. But can we manage them? Usually between around 10 to 15 treatments, both sets of patients start to feel better. But in order for let's say, the periods of time where the quality of life is at its peak, you probably need somewhere between 20 and 30 treatments, John. And then you're going to need a maintenance. There's no question about it.
And this is once or twice a week,
right?
Pretty
In
much.
The beginning,
okay.
Maybe the first 5 or 10 we want to do twice a week, probably for both the type of patient. Again, it depends on the severity of the condition. But I got to tell you, as I say before, most times when people come into me, it's desperation.
Absolutely, yeah.
Or they've been told it's all in their craziness in their heads, and nobody has really definitively found what the condition is. So, yes. Definitely, it takes a little while. But, we're only looking between 5 and 15 weeks out of your life.
You know, if you had $1 for every time a patient told you what the doctor said to them or
Oh,
one of
my
the physicians
goodness.
said, you'd be wealthy.
I would. I wouldn't have to have a clinic.
Exactly right. Okay. All right. 855-839-1210 is our number here if you got a question for Dr. Molly or you have a particular medical challenge you want to discuss with her. Everywhere we go, we're still hearing COVID. COVID. And it seems to mimic a lot of different things.
You bet.
So talk about COVID and long haulers and so on.
It's a very interesting thing. I have a wonderful patient, very wonderful woman, has a wonderful family. They came in to see us yesterday, both Dr. Mark and myself at the office. And it's very interesting because she had COVID and now she's faced with the long hauling situation. And in her case, it's really interesting because it's been a mixed etiology. She certainly has the ground glass appearance in the lungs, but she has so many problems in the GI tract that this is why we're finding ourselves really in a quandary, because we started to look and research this. We're not seeing so much in terms of people who have GI problems past COVID, but maybe they're just not putting it together. You know, and eventually we're going to have a list of side effects that are probably going to be well known as this continues to go. But this is an interesting case because it's inflammation anyway. No matter how you slice it,
right,
you're left with an inflammation process.
All right, let's go to the phones. We have Tom in Pennsburg, PA. Tom, good morning.
Hi, Tom.
You're on Health Watch with Dr. Molly.
Morning.
Hi, Tom. Hi, Tom.
Yeah, I heard that fibromyalgia might be related to diabetes.
Yes.
Have you heard that?
Yes, they're just recently coming up. They've actually been doing a statistical study on that, and they are finding out that there may be a link. And if you think about diabetes and you think about all the other problems you have with it, why wouldn't you have a certain amount of the fibromyalgia kinds of things, including the arthritic kinds of conditions that can develop? You know, hey, listen, that molecule is a big molecule you're pushing around when you have diabetes if your blood sugar's high. So yes, I have heard about it, and I think that, of course, in our protocol, actually, it's interesting you mentioned it, we actually take the position that if a patient has diabetes and is coming in with some of the muscular type pain, we also put in something that would actually help the diabetes, including ALA, which is alpha lipoic acid, and several other things that help the diabetes as well as the muscle cramping. So great question, great thought. Thanks, Tom.
Okay. Yeah, one other thing, vitamin D.
Oh, absolutely.
Do you check the blood for vitamin D?
You bet. We routinely check the blood for vitamin D, and again, vitamin D is an integral part of all of our protocols, in particular for people that have conditions like diabetes, fibromyalgia, chronic fatigue, and even, by the way, post-Lyme and post-COVID, anything that has to do with the viral conditions. Interesting you talk about vitamin D today. I have a very interesting case that came in yesterday as well. She's a school teacher, elementary, first grade school teacher. Her vitamin D level was 20. Her doctor told her that was okay. Now, she's in a classroom situation where she's been mandated to wear the mask, right? But the children haven't been, right? Because they're too young. So, is she exposed? Maybe. You bet. And if her vitamin D level is low, don't you think that's also an added risk? Answer is yes. Thank you for the comment, Tom.
Yeah, Tom, thank you for the call. Really appreciate that. Speaking of vitamin D, your nurse Barbara 3 years ago told me, get vitamin D.
Of
and
course.
she told me where to go and get it.
And get the kind.
I take it every day.
D with D3 with K2. Absolutely, unequivocally, vitamin D is part and parcel of our protocols. And I don't mean to minimize the importance of vitamin D, including for this person that we saw yesterday. So getting back to her case, and it's interesting because in her case, I really need to look at what am I going to do for her gut, because she can't eat. She can't eat. And this has been as a result since the COVID. Well, we're handling her lung issue by utilizing our protocol for the pulmonary. But I actually put her on a good probiotic for her gut. and also enzymes that really is based on the work of Dr. Gonzalez from New York, God rest his soul. And what we want to do is really focus in now on both her GI problem as well as her respiratory problem. And this, again, is post-COVID.
And again, you've talked about how these symptoms mimic some other things.
Right.
So it sometimes gets confusing for patients because they may have this and it looks like that, but they don't know exactly what it is.
What I appreciated was that Dr. Mark got right on this with me. We were able to send the patient out for the testing rather quickly, and we realized that, thank God, we weren't looking at anything life-threatening in the moment from her GI tract. That was very important, both for the patient and for us, to make sure we weren't missing something. And just because, as I always say, just because a patient comes in and says, well, I have COVID, and we look at what statistically the long haulers are feeling, doesn't mean we should ignore some of the more subtle symptoms.
All right, we're coming up on our final break of the morning. It's Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. Couple of minutes left of the show. If you want to jump in with a question, 855-839-1210, 855-839-1210. Coming back with more Health Watch after these words. Health Watch is the show, and operators are standing by right now at Innovative Medical Associates. They'll be there well after we leave you at 9 o'clock this morning. And their number is 856-489-0505. That's the number you can call right now, or you can call during the week. That's the number for Innovative Medical Associates, 856-489-0505. It's Innovative Medical Associates, Marlton, New Jersey. And the website is innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And don't forget, if you missed any of today's show, or if you want to hear it again, I mean, you're certainly welcome to do that. We have our Health Watch replay, which comes from 4 until 5 this afternoon, right here on Talk Radio 1210 WPHT. Couple of minutes left of the show, 855-839-1210. If you want to call in with a question or a thought for Dr. Molly, 855-839-1210. I know you always like to talk about new patients because it brings out some conditions and challenges that people have and how you ultimately treat it. So talk about this new patient who's a pharmacist.
Yeah, I have a very young girl who's a retail pharmacist, and she's really, really bright, brilliant young lady. So, we started talking. She has a lot of, one of the reasons why I was talking about fibromyalgia today is that she has a lot of symptomatology that relates to the fibromyalgia. But in talking to her, I find out that she had an exposure to mold. Very interesting kid. She went out, she bought the mold kit, she had the place tested. She found out she did have the mold there. So what did she do? She took the pharmaceutical remedy for the mold. It's an oral. She proceeded to follow that protocol. But at the end of the protocol, she felt like she was worse. I believe that she got rid of the mold, but what she didn't get rid of was exactly what I talk about, the autoimmune response to the entire process, including the response to the medication. So she ended up with the side effects of the medication, also the mold exposure. So what we are doing is we're treating her, and she actually sent us a beautiful basket, a fruit basket, because she said third treatment she was feeling better, and more importantly, she felt listened to, that this wasn't in her head, that she's an educated person in the medical field, and we took time to listen to her and then put out a plan that apparently is working for her.
So it's kind of like a variation of the same theme.
Of course, we have to look at the patient. I'm a big believer in environmental toxins. You know that, John. I'm a member of the environmental medicine group. I believe that our epigenetics are really somewhat more responsible than our genetic propensity. Yeah, we have the genes that are going to give us lung problems. We have the genes that might give us cardiac problems. But what really causes some of these things to actually happen to us? It's the outside forces, including the environment. So I'm a big believer that, just because we have a genetic propensity for, let's say, lung disorders, doesn't mean you have to suffer from them. We have some things to help you. just because you have a cardiac propensity doesn't mean you have to have it. And gosh knows I have the data to support that for 20 years worth of work. So we know.
So these conditions are difficult to diagnose, and that's why I guess you get these diagnoses where people are told, well, you know, it's in your head, and you're, you know.
Nah, what you do is, as I say to you many times, I'm like a medical archaeologist. We go through your file and we look at what the conventionalism has put together, and then we're able to really get down to the nitty gritty and put a program together for you. And that's why, look, John, this is not one size fits all. I can't tell you enough of that.
With this new patient, and you're talking about this condition, again, is this a 15 treatment, 20 treatment
she's in for the 30 treatments, but she knows she's going to be a lifer, and she's actually said it. I know that I have to be aware of this, maintain my health, and then I will have a good quality of life. And at 30-something, why shouldn't she?
I know you really study all these things, but have you ever figured out why do we have so many of these problems? I mean,
I think it's environmental. I think that there are so many viruses, not just COVID. There are a lot of viruses out there that people don't even know they have. And that altogether can cause problems. I mean, you know, hepatitis C, we talk about hepatitis A and B. Nobody's talking about the lesser hepatitis, if there is such a thing. A and B is just as tough on you as hepatitis C that we have now the conventional cure for. So, heck, you're going to have some side effects to all of this. We have to detox and move forward.
All right, let's get a quick call in here.
Sure.
Shirley is in Haddonfield, New Jersey. Shirley?
Hi, Shirley.
Good morning. Welcome to Health Watch. You're on with Dr. Molly.
Hi, Shirley.
Good morning. Dr. Molly, I have a question about bitters. Are you familiar with bitters? Yes.
I love bitters. Go ahead.
Okay, because I'm taking one for lymphatic system, circulatory, and...
Well, they're herbs, right? Yeah. So you're taking some herbs. Are you taking like horse chestnut? Tell me, you don't know what the combination is, but there are a lot of God's ingredients that are in herbs that are called bitters. In the Italian world, we have a drink that is made out of bitters that actually has a component that can aid people while they're going through some cancer treatment. So yes, there's a lot of bitters out there. I think they're fine. I think you have to take them properly because bitters are herbal medicines. So we want to take them appropriately and get some direction with them. But I'm absolutely 100% for those types of products.
Well, now, when I take them, should I eat less?
Eat less? I don't, Shirley, you're asking me hard questions because I don't know your challenge. But I will tell you that we've used bitters in our facility, and we have used them in the bag as well because there are herbals that we're able to make in tincture. So I hope that helps you, Shirley.
Shirley, thank you for the call.
Thank you.
And good luck with the bitters.
God bless her. God bless her. Hey, listen, the Italians want bitters in their cocktails, so let's be honest.
I was laughing when you said in the Italian world.
Yeah, that's right.
We can relate to that.
Absolutely. Absolutely.
If people are just not feeling good and they can't pinpoint
come on in.
That's what my question was.
Come on in and bring with you your latest labs. Bring things that I can use as a cornerstone for what we're looking for. And more importantly, bring what's bothering you. Why do you feel that you don't have a good quality of life?
And I know you do that a lot with the first consultation, in that you discuss with them their situation, and you ask a lot of those kinds of questions.
And I want to hear what they're looking to do. Because in the end, John, look, our quality of life is unique to each one of us. Some people just want to be around to play with their grandkids. Other people want to work till they're 120. It's a big difference. And in the end, though, quality of life is what counts.
And I've seen you look at somebody and say, you have such and such. I've seen that, and you were.
I'm not a medical intuitive, but
you're generally right.
Wow.
And that is going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by right now at Innovative Medical Associates at 856-489-0505. That's 856-489-0505. And they'll be there well after we leave you at 9 o'clock this morning. And there's no Eagles game today. So, you can call all afternoon. They'll be there. All right, 856-489-0505. The website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, delightful Dee, Barbara, Joanne, fabulous Fran, and our nurses Jess and Crystal, and our medical assistant Kathy, I'm John DeMasi. Thanks for listening. Have yourself a great week and a healthy one. We'll do it all over again next Sunday. Health Watch 8 till 9, Talk Radio 1210, WPHT. You take care.